Welcome, this is Dr. Paul, and we're coming to you with a special segment from the top of the Rocky Mountains at 12,000 feet. I have a guest speaker, expert with me today, Miss Jean Reilly, and it's a real privilege to have her on the show. She's been a part of some instrumental research that deals with tub baths, infant body temperature, and also very interesting observations about cord care, along with, I know she's done the literature research about cord care, so I thought this would be an important topic to bring to our viewers. I probably would like to start off with having Jean Reilly just describe for us her background, her institution, and the study that they've taken.
I am a postpartum staff nurse at Brigham Womans Hospital, which is a Harvard Medical School affiliate, and I have been working in postpartum with moms and new babies for 20 years. I have been involved recently in the last several years in a study that we did on comparing temperature regulations, comparing two ways of bathing newborn late preterm babies, which are the babies that are born about 4 weeks early. The study was comparing 50 babies that were tub bathed with 50 babies that were sponge bathed to discover which method of bathing was better for their temperature regulation. And there has been a similar study done in Europe that showed with term newborns, which are the full term newborns, the big babies, that they did better with tub bathing. So we wanted to see with the even more delicate population, what is the better way to do that first bath? And we found unequivocally that tub bathing does help them regulate their body temperature better. They drop their temperature less on average when they were tub bathed, and they warmed up quicker when they were tub bathed than when they were sponge bathed. So this was groundbreaking research for late preterm babies, and a very exciting study to find out what's the better way to bathe babies. When they are sponge bathed, cry harder, they burn more calories, they don't breastfeed as well after a sponge bath, and that goes for term as well as late preterm babies. And so that's just our observations also. So it's a wonderful way to teach your baby to enjoy bathing, and to also for the parents to enjoy bathing your baby.
So Jean, where exactly was your study published?
Our study was published in the journal called Joggin. It's a nursing journal, and it was just this last year, so in 2012. If you wanted to find it, it would be under Bathing of the Late Preterm Infant. So that's where it's studied, in Joggin magazine. So
I'm curious, Jean, what were your observations with regards to cord care? Because I know a long time ago we used to bathe infants back 20, 30 years ago, and then over the last 20 years that I've been a pediatrician, it's been no baths, sponge baths. For the longest time it was alcohol around the cord, and then actually lately it's been just leave it alone. So there's been this sort of evolution of what we should do with an infant's cord, and I know you have had some great observations as a part of your study. We at our hospital, at Brigham Womans Hospital in Boston, actually have changed our practice. We used to do alcohol on the cords, and we had, through the literature search of a large study done, it was found that air drying was actually better for the cords than the alcohol method. And so we, as nurses, were very worried about this, because we get ingrained in our practices. Right. And we actually observed that the cords dried up quicker when you just air dried them and didn't clean them off with alcohol. Now, some of the pediatricians who also were ingrained in their practices were really concerned about maybe a potential for a cord infection, and so they wanted to address, how do the parents care for these cords if we're no longer alcoholing them? And what we observed in our tub bathing study is that these cords were naturally cleaned by putting the baby into the tub bath. And all the parent then has to do is dry around it carefully when they're done bathing, which you would dry your baby anyway. So air drying and tub bathing is actually the preferred method for cord care. They don't get, well, I'll let you explain what you've seen, but we don't see that they get any gumminess or dirtiness at the base of it if they're tub bathed. Right. Well, that's very much what fits with my observations. So thank you for sharing that information. Oh, you're welcome. And I want to thank you for coming on, Dr. Paul. Thank you. And sharing your knowledge and wisdom. We are certainly blessed to have an opportunity to have an expert who's actually published. Meet me at the top of the Rockies to discuss this topic about bathing newborns and cord care. Visit us again soon. This is Dr. Paul. Remember, I'm your pediatrician.